We're all familiar with the traditional role of emergency departments, and we're familiar with the fact that they resuscitate patients, deliver immediately life-saving treatments. But the reality is that's not the only thing they do. A big portion of what emergency departments do is they're an entry point into our system for undifferentiated patients, and those patients are assessed within the emergency department, diagnosed, treatments commenced, and then sort of referred along appropriate lines for their follow-up care. So there's a proportion of patients in the emergency department, whilst they may be very complex patients and they certainly need emergency department expertise, they don't need immediate resuscitation, they don't need any immediate physical interventions. And so that group you can assess using telehealth, and you can assess, you can diagnose, you can commence initial sort of treatments in the community, and you can refer them to community services and other avenues for follow-up. And that's really the group that Waved is focused on. And by bringing that emergency medicine assessment right into people's homes, then that's got clear advantages for that patient. It's quicker, it's much more streamlined. We know a lot of people would prefer to receive their care at home if they can. And then there's some distinct advantages if that patient doesn't need to attend the ED, in that those ED resources are then available for other patients. If an ambulance doesn't need to be deployed or an ambulance doesn't get ramped at a hospital, the ambulance resource is available for other people in the community again. So there's this win-win in that the patient receives the care in their own home, but we're freeing up resources that other patients can then access. So Waved is about that streamlining of patient management, but that win-win for the system of increased freeing up capacity, both ED and ambulance. It's safe to say, or it's fair to say, we're still in the early days of this journey, but over time, as we grow and mature our other community-facing services, including hospital in the home type services, that we can enable more and more ED avoidance and more community-based treatment. Currently, Waved is seeing a little over 400 patients per month, all of whom have called 000, and all of whom, without a Waved intervention, will be taken to emergency departments. Those patients are seen and assessed by senior ED clinicians, and 72% of those patients don't go to the emergency department. So 72% of those patients, the vast majority, receive care in their own home, and some enter our health system in an alternative way to via the emergency department. And as I said, we're confident that we can increase that number substantially as we leverage off the other work going on in terms of community capability.